Dermascience Stride Study will be providing one pair of Dr. Comfort diabetic shoes plus 3 pairs of custom inserts for all patients at the end of their clinical trial. You'll receive the following products: 1 case of foam impression boxes with shipping labels for Dr. Comfort, 2 rolls of 1/4 inch felt used to mark lesions for deep impressions into the foam to properly accommodate all patients' at-risk location for plantar foot lesions, order forms, and catalogs from Dr. Comfort shoes. Dr. Comfort will have all the investigational sites information and will be invoicing Dermascience directly. Our recommendation for impressions with lesion markers will be demonstrated at this time. A patient having lesions in 3 locations, you take the felt 1/4 inch, adhere it to the lesion site, covering at least the lesion site plus a little extra space, which then will allow it to be used to mark a deeper impression into the foam itself. Next, the patient will be sitting with a 90-degree position for their legs and their thighs. The impression boxes will then be placed as you normally do for casting or impression cast foam for taking impressions. Here we have the first metatarsal lesion marked, slightly larger than the lesion itself. We will place the patient's foot centrally into the foam, turn them so that they can be at 90 degrees, hand over hand, pressing in the heel firmly. Then pushing the toes firmly into the ground of the foam and then pressing along where the lesion markers are located and the midfoot. I gently move the foot side to side to make sure that the impression is well taken on both sides. The foot is then removed and the same procedure is then performed on the opposite side. Again, we will be taking and putting hand over hand, firmly getting the heel into the ground, then toes firmly into the foam, metatarsal and lesion marker firmly against the foam, and then the midfoot. Side to side, slight movement allows for the lesions to properly be placed, and the foam insert, as you can see now, has a deeper impression sub-first metatarsal.